So the HeatNexus cohort or network is a group of 9 research projects globally working on climate and health research. They're implementing some similar interventions, some different interventions across in their different contexts.
We're hosting a range of different projects from countries around the world who are looking at interventions which can help people adapt to heat in ways that protect health. So they're doing active research in communities as people are living and going about their daily lives, which is quite a complex, challenging way of doing research.
We were requested by Wellcome Trust to think about how do you support an entire network of very disparate projects and people globally that are working on climate and health, kind of heat and health research.
We have quite a bit of a dearth in terms of intervention research in climate change and health in general, but especially the research and evidence from low and middle income countries is much less. So this is one of the largest cohorts of researchers in developing countries looking at the evidence on what are the effective heat adaptation interventions to help protect people today.
With this particular network, we have a multi-pronged strategy. So our main intent and objective is to think about how do you bring the knowledge that's coming from across the network in a space where it can be debated, discussed, but also where we can find some synergies and learning, but also to see how that can be amplified. So going beyond this network. So IDS's role in some ways is to help the network think about the kind of engagement and stakeholders they would want to action on what their results are showing, and to have the strategies and the skills to be able to do that.
So one of the unique things about this particular call was that it required the principal investigators from the research projects to be from and based in a developing country where the research was going to be taking place. And part of the rationale behind that was to ensure that the investment and the capacity building that happened as part of the research would actually benefit the countries where the research was going to be taking place.
We have experts in our team on monitoring, evaluation and learning to help facilitate this. We've got impact communications colleagues in our team that will help with that capacity strengthening and the amplification. Our researchers in the team are focused more on the synthesis kind of work and methodology behind that.
The most exciting thing is really to be able to help advance the evidence on what works to protect people from the effects of climate change on health in developing countries where the needs are greatest. They're working in some of the most vulnerable communities across Africa, Asia and Latin America, and are really trying to find solutions that are co-produced with those communities.
Why do we do research if we're not wanting that research to actually effect improvement in the lives of people and the planet?